Hello, and thanks for the opportunity to talk to you today on social media and practice implications. I'd like to first confirm that I have no disclosures, and with that, we'll get started. Our objectives for today include that following the presentation, participants will be able to describe at least 3 potential risks for the healthcare team when using social media. They'll be able to list at least 2 risk management strategies to minimize your risk when utilizing social media. You'll be able to describe at least 2 potential advantages to social media in your practice, and list at least 2 ways social media can cause physician stress and impact medical professional practices. So what we'll cover today, we'll cover what is social media in healthcare, the benefits and the risk of social media, and some professional liability risk reduction strategies for your practices. I'm guessing that here today, many of us don't use a dictionary, an actual book, to look up a definition. Most individuals just go online for a definition of their information, and here you'll see the Webster's dictionary definition for social media. The social media is really a website or platform that allows the creation and exchange of user-generated content. This collage represents several popular social media applicants. There's YouTube, Twitter, WeChat, TikTok. Instagram was launched completely based on sharing photos and videos, and now it's part of Facebook. YouTube is the world's largest video sharing social network site. I think we can all agree that social media is here to stay. And according to a press release, Twitter estimated an average of 330 million monthly active users in the world in the last quarter of 2017. LinkedIn has 675 million monthly users. And according to Pew Research Center, Facebook is used by 46% of adults over the age of 65. And Facebook now has over 2.7 billion monthly active users as of quarter 2 of 2020. So definitely a growth trend. This slide represents some statistics on social media use. 3.5 billion users worldwide, which equates to about 45% of the population. 5% of American adults used at least one platform in 2005. Over 50% of adults in 2011, 72% of American adults in 2019, 2% of Americans age 65 plus used at least one platform in 2005. By 2011, that was up to 12%, and in 2019, that was 40%. So what has social media changed? It's changed the way the world obtains information and how we share that information. For those of us who have been around for some time, we used to get physical mail to our offices and open the mail and construct letters and mail back information. Together with technology, it's changed the way we interact with each other, and it's changing relationships, including the physician-patient relationship. Social media is exploding in healthcare. It's estimated that there's 94% of hospitals with a Facebook page, 51% with Twitter accounts, 99% have a Yelp page, and hospitals with Foursquare check-ins are 99% of hospitals. Most hospitals in the U.S. have an active Facebook page, and they're establishing a presence on other platforms as well. Physician use of social media is also growing. 71% of U.S. physicians reported using social media for personal reasons. That usage was very high by physicians aged 25 to 34 years. 54% reported using it professionally. Again, 25 to 44 years of age had high usage. And professional use was defined as news, conference updates, CME notifications, and other passive forms of participation. I think one thing to note is not whether your office will engage in social media, but when and to what extent and for what purposes. So I do want to stress that this is a business decision for you and your practice. We know some reasons why healthcare in the past has been slow in adapting to social media. Federal and state and legal issues related to privacy, and of course, ethical considerations. And with the pandemic, we've seen urgency and necessity to see patients other than in person, and that has moved us exponentially to using more social media and in particular, telemedicine. So let's talk about some of the benefits of social media for physicians and their practices. Physicians can access many online courses to obtain CMA courses needed for licensure or to update and enhance their current knowledge. These online courses can save time and money and travel and expenses to conferences. We've all seen our educational conferences and CMEs go to almost entirely virtual with the pandemic. Physicians can also share ideas and information on what they're seeing in their practice and what's working on a professional site. They can connect from colleagues around the world very easily. It can also save your practice money on advertising over the traditional advertising methods. And since social media is so widely used, they can reach more patients than ever for advertising purposes. So what are some of the other benefits for using social media? Well, there's patient education, engagement, and satisfaction. Practices can post educational information on your website to help you educate your patients on their disease processes. Patients that are educated about their diseases tend to have improved compliance and outcomes because they've been told what to expect. The patient might then have more realistic expectations. So the patients and their families can also see information related to treatment options that are being outlined, dietary recommendations. You can also use your website to connect patients to support groups and other online resources to help increase patient engagement, improve outcomes, and improve their patient satisfaction. Some practices have online pictures of their office staff and even bios. Utilizing social media such as email through a patient portal can allow you to communicate and allow the patient to ask questions. That sometimes makes them feel that you're more accessible and gives them increased patient satisfaction. Some other potential benefits of social media use in your practice might include that this education makes them more realistic about their expectations of their disease process, so they might get more engaged and then again see improved outcomes. Productivity can be increased when utilizing social media for patient online scheduling, appointment reminders, communications with patients regarding their questions, and other avenues. Physician offices can post their office policies and procedures online so a patient is aware of expectations prior to even joining the practice. This sets up expectations early for issues that can often result in conflict, like cancellation of appointment fees, medication refills, payment for services, what the charges are for filling out forms, and the turnaround time for medical records requests. It also tends to make the job of the office staff less stressful so they can have increased job satisfaction. So we spent some time discussing some of the benefits of social media in a practice. And as we know in healthcare, with benefits, there are also usually risks. So now take a look at some of the risks of utilizing social media in your practice. Again, especially since the pandemic, many physicians and practices are using social media technology, at least to some extent. And I want to stress to you again that how you do that and how much is a business decision. So I'll briefly just cover some of the common risks, and then we'll get more in depth as we move through the materials. The most common security risk is when an employee might inappropriately release any form of company information. And that could be anything from intellectual property, trade secrets, or patient information. There's appropriate professional boundary concerns and control over information and posts, as well as potential distractions from social media use. The most common security risk is a breach of information from the organization. There's also the reputation risk to your organization or your practice, safety and security, and of course, cyber risk is an ever-growing concern. We know that one of the first issues to come to our mind when we discuss social media use with physicians are HIPAA concerns. A breach of confidentiality is an unconsented, unprivileged disclosure to a third party of non-public information learned in a confidential relationship. In healthcare, we immediately think HIPAA violation, And there's a lot of training that goes on around HIPAA concerns in healthcare. Patients do share with us the most private of information, including medical conditions, financial status, and information and personal identification when they're obtaining their health care. And it's their expectation that it remains private. So a physician or a practice will be held accountable for lost or stolen information. In addition to protected health information, there's also the need to protect PII, or personally identifiable information. These can be some of the areas of a practice doesn't really think much about because it's not medically related, but the information still needs to be protected. This is just a reminder that there are 18 identifiers that must be removed prior to posting. Most times we think of the obvious identifiers such as the name, date of birth, medical record number, but there are a few examples we may not often consider, like biometric identifiers, fingerprints, retinal scans, voice prints, full face photography, or other images, and something that is uniquely identifying, such as maybe a tattoo. So what happens with a breach? There can be civil and criminal penalties, state licensing boards can take actions, and there's often negative publicity associated with the event. HIPAA fines can be very severe, and they usually base them on the type of violation, and if it's a knowing violation or an inadvertent violation. And the fines can go anywhere from $10,000, $1,000, $50,000, and there's maximums per year. Unfortunately, those fines do not include the cost to cure the breach, such as reporting requirements, notification requirements, credit monitoring. And these events are not only expensive, but they can be very time-consuming and also do damage to your reputation of your practice. According to Healthcare Finance, there were in Q3 2016 to 2019, 93% of healthcare organizations experienced a data breach. 57% had more than 5 data breaches, and the average estimated cost of a data breach in 2019 was $423 per record. Not only has the number of attacks increased, but more than 300 million records have been stolen since 2015, affecting about 1 out of every 10 healthcare consumers. It's also very easy to have an inadvertent HIPAA violation connected to social media use. 2 examples are on the slide, and many individuals, including healthcare workers and professionals, leave work and they connect to their social media. Certain social medias create security risk hotspots like Facebook and LinkedIn. LinkedIn encourages employees to talk about what's happening in their professional lives, and this can create a challenge for hospitals whose workers leave and want to talk about their day. Workers in industries like healthcare are at risk for targeted phishing attacks via social media. And phishing is defined as requesting confidential information over the internet under false pretenses in order to fraudulently obtain credit card numbers, passwords, or other personal data. They might seek people on LinkedIn or Facebook who work at a specific hospital and send that person malware. So it is important to teach your staff about phishing attacks and to be careful about those sorts of things. These 2 examples are where an employee in the OR took a selfie and posted it to Facebook, indicating they were starting on their vacations. But what they didn't realize was that the whiteboard behind them actually had patient information names in the background. And then there's an example where a hospital photographer was shooting pictures of a resident for an online newsletter, but they didn't realize the resident was sitting at a computer that had PHI on the screen and it was visible when enlarged. Another example is when nurses working on a shift together are at the hospital and they had a coworker snap a picture of them in the hallway and text it to other nurses. They didn't realize the patient was walking down the hall behind them in the picture and their face was visible. And the second example is where a plastic surgeon posted a picture of their new building. They didn't realize that a patient was exiting the building in the picture and the patient didn't give permission, so they may not have wanted people to know about their plastic surgery. These are really not intentional, and oftentimes they're not even realized until others expand the pictures or until they're posted and sent. So typically they're not malicious, they're inadvertent disclosures. In this example, one employee had a really hard lesson after posting on Facebook. They posted about their clinical cases they had seen in the emergency department, and the physician didn't realize that the comments were not specific patient-wise, but they had other identifiers enough for the patient and the family to recognize who it was. So the state licensing board and hospital employers took action for inappropriately posting confidential patient information. So depending on where you practice and the size of your community, this may impact you if the information is identifiable. In a smaller town where everyone maybe grew up together and knows each other, less information might be needed to identify an individual. So be really careful about that. This slide provides some stats on a survey related to social media issues in medicine. It indicates that 30% of medical boards reported at least one of several online professional violations had been reported to their board. A study by Quantia MD reports that 13% of physicians admit to having used public platforms to hash out specific cases with their fellow practitioners, and just to talk about it and try to figure out what to do. More than 10% of medical boards handled an episode like the one at Northwestern Memorial, where it involved depictions of intoxication. In 2018, the Federation of State Medical Boards chairperson tasked a committee with providing updated guidance on the use of social media and electronic communication in medical practices and by state medical boards. What they are really trying to do is provide some guidance and clarifications to physicians and advanced healthcare professionals about social media use. This is an example of an off-duty hospital employee who photographed what they felt was an attractive female in the emergency department and posted the image on Facebook with the caption, "I like what I like." He and several of his colleagues were implicated in the misconduct and they're no longer employed at this facility. So these are the types of examples that can happen when physicians and staff are off-duty and not thinking about the implications, but it is a clear HIPAA violation. Professional boundaries. It's in a survey of 48 state medical boards, 44 reported online related misbehavior with serious disciplinary consequences leading to license restriction, suspension, or revocation. A 2011 study of physicians on Twitter revealed that 10% of the physicians sampled had tweeted potential patient privacy violations. And a 2014 study of publicly available Facebook profiles of 319 Midwest residents found that 14% had potentially unprofessional content and 12% had clearly unprofessional content. And these included references to things like binge drinking, sexually suggestive photos, and HIPAA violations. So it's amazing what's out there on off-duty. Here are some examples of unprofessional conduct posted by medical students online. Profanity, depictions of being intoxicated, some sexually suggestive material, violations of patient confidentiality, and really obviously discriminatory language. I thought it might be important to mention this because many of you interact with medical students, and we know that many medical students are young and therefore likely to be big users of social media in so many aspects of their lives. And in JAMA, September 2009, a survey of 78 U.S. medical schools administrators reported student posting unprofessional content online. Some of these reports were serious enough to lead to disciplinary action and expulsion of the student from school. So let's talk a little bit about online patient posts about your practice. Negative reviews on your physician or practice grading sites is becoming a big concern for physicians and practices. And let's face it, once something is posted, it's most difficult, if not impossible, to get it removed. And if it can be removed, how many people have seen it and reposted it before it's taken down? According to HealthGrades, consumer trends show that patients use online reviews quite frequently. 84% of all patients use online reviews to evaluate physicians. of consumers say that they trust online reviews as much as personal recommendations. That did surprise me. And 77% of patients use online reviews as their first step in finding a new doctor. So the statistics are now reflecting what we felt for some time. Online reviews can play a significant role in your patient acquisition and in your patient retention. So how to respond to negative online reviews from a patient is another question that comes up a lot. We would recommend that you consider if you only have a rare negative review and many positive reviews, it could just be that individual's perception. So look for trends. Patients also use other factors in their decisions to choose a provider, such as recommendations from family and friends, education and training of physicians. So it's not just online reviews. The negative comments might also provide insight to something you weren't aware of, like a problem with scheduling in your office, or an employee who gets a lot of negative comments in the way they interact with patients. You might get complaints that the patients feel rushed when they're being seen by a particular physician or nurse practitioner or PA. Complaints that the physician didn't explain things well to them, or the level of discussion was too complicated for them. So you can learn from these and make changes to your practice. But overall, you do want to remember to remove the conversation from online. Don't be argumentative and don't make demands or requests. Some suggestions for responding are that we thank the patient for telling them what upset them. Typically, when patients feel that their concerns have been heard, it decreases their anger. So letting them know that you plan to use the information they provided to consider changes or even to make changes makes them feel empowered and listened to. Just make sure if you promise a change that you do deliver on it. When they return to your office, they'll be looking to see if you really meant what you said. So don't make promises you can't keep. Sometimes patients aren't comfortable with face-to-face telling someone what they're upset about, so it's easier for them to post online. You might want to have other ways patients can let you know about large or small concerns, like a suggestion box or a patient follow-up satisfaction survey. Another way is just to ask the patient before they leave, do you have any concerns? How did your visit go today? That way you're bringing it up and it gives them a chance to expound on that. Another concern that's becoming more prevalent is digital distraction in healthcare. And it really can affect patient safety and well-being. Some people call it distracted doctoring. Device distraction also adds stress to physicians who are trying to balance responding to non-work-related digital requests and routine patient care. But it can also come from texts and emails that are patient care related. We really do live in a world where people expect responses quickly, even when they're not urgent. So we are often not patient with others. So what happens then? Devices like computers, smartphones, and other devices have been heavily invested in the medical realm. So we want to have quick and instant access to our patient data, drug information, and case studies. But these can also have other intended side effects for the physicians or people on the healthcare team. The patient might perceive that they're focusing on the screen and not them. And that could happen in critical times and have bad outcomes for the patient. If the physician is in the room and he's looking at the screen, the patient might think they're not paying attention to them when really they could actually be looking up a medication or something specific to that patient needs. This case example demonstrates how dependent we all get on our devices. There was a malpractice case in Denver where a patient was left partially paralyzed after surgery. The neurosurgeon was making calls during the surgery. He was using a wireless headset, making personal cell phones, and at least 10 of them were to family and business associates, according to his phone records, which were introduced into the lawsuit. Obviously, that was settled out of court by the neurosurgeon, but it does show how it can be brought into your world. Remember, it's easy to retrieve call logs from our devices that indicate who was called, what time, and for how long, and that can be devastating in a malpractice case. I've actually been involved in more than one medical malpractice case where personal cell phone logs were retrieved by the attorneys in the matter, and one was by the defense counsel to prove that the calls made by the attending and others were done related to the patient care, and the other was by the plaintiff counsel showing that the defendant was making personal calls during a particular time frame. So what can we do about the risk of digital distraction? One of the most important things is to educate our care team. Educate and have a culture of patient safety. Staff members need to feel that they can speak up when they see a distraction. In the example with the surgeon in the OR, it seems apparent that the OR team would realize that all those calls in a case weren't appropriate. Maybe there wasn't a culture that allowed for them to speak up or to escalate the situation if they were ignored. So you want to model appropriate behavior for personal electronic use. Have office procedures that don't require immediate responses to non-urgent matters. For example, you might want to batch non-urgent messages so they can be reviewed and responded to in a non-urgent time frame. Have policies in place that limit internet access to work-only related sites, and monitor and enforce the policies. Practice and stress situational awarenesses. One example that I was aware of was when TikTok had viral videos of a nurse that was mocking patients for faking their symptoms. It went viral, and there was a hashtag movement that led thousands of users to share moments when their medical providers didn't believe them in their symptoms. And these types of things can really erode patient trust. So now we're going to focus on what may be one of the greatest risks with social media in healthcare at this time, and that's cybercrime, which can include hacking, phishing, and ransomware. There are a host of ways that criminals can target your social media. They can attempt to access patient information through EMRs, billing information, patient portals, and smart devices. These attacks were increasing, and since the pandemic, experts are saying the attacks are even more common. Cyber criminals have gotten very sophisticated and savvy over time, and they've made the simple act of clicking on a link a way to plant malware in your devices. So what can you do to protect yourself and your practice? Well, first, you really want to educate and learn to recognize phishing attempts. And phishing is one of the easiest and primary ways hackers can access your practice information. What can you do then to prevent or at least slow down hacking activity and other forms of cybercrime? Some of the easiest ways are to use two-factor or even more authentication, and that increases the work for them to hack your account because hackers typically look for easy targets. So a two-step security system, such as a password and a PIN, or a password and a text to your phone. Answering security questions is another way to make it more difficult. But remember, if you use social media with your family, your social media might contain information about your names of your family members, where you went to high school, and those are typical questions that are asked when you're setting up those security questions, and it's easy for hackers to find those if you put them on your social media. A tip that I learned from a computer-savvy friend of mine is that most people capitalize only the first letter of their passwords. But by capitalizing other letters in your password, it makes it more difficult for the hackers and their hacking tools to crack your passwords. So to stress some global recommendations to reduce your risk, you want to implement a strategic plan for social media use in your practice. Develop policies and procedures for social media use in your practice. Educate your staff on the appropriate use of it, and that includes what they post during office hours. Ask patients if they have concerns or suggestions, and encourage patients to use a suggestion box for complaints. You always want to maintain privacy of your patients. Monitor the physicians and practices' social media and internet presence. You want to manage the message of your practice from your website and what goes out on social media platforms. Use the highest privacy settings. Keep your anti-malware updated, and use secure email and text applications, platforms, and services. Some additional recommendations for risk mitigation include separating work-related social media from personal social media. Have integrity. Do what you say and say what you do. Ensure that your current practice information is on the website and social media platforms, so keep things updated. Continue to be professional in your interactions on social media. Control technical and physical access to PHI and PII. And perform routine cybersecurity assessments. We'd like to point out that it's really important to do a risk analysis of your practice from an IT perspective to identify and work on correcting areas of concern or vulnerability. Having routine audits and reviewing your audit trails to conduct risk assessments can give you a heads up on issues you may not otherwise have been aware of. So just to recap, social media is here to stay in healthcare. It can be helpful and challenging to your practice, but having a plan to effectively manage the parts of social media that you can help you navigate through that exposure. How each practice or physician does that is individualized. Some physicians may really enjoy social media and technology surrounding it, and they might develop a full-scale plan for website development and marketing. Another physician might just want a basic website and hire a web developer. And still others may want the very least involvement they can have with any social media, maybe just posting office hours and address. But no matter what you choose, patients will still use social media, and having a plan, however complex or simple, and how you utilize social media in your practice can be very helpful. With that, I'd like to thank you for all your time today, and I believe we're going to open it up for questions. I have provided slides with references and resources as well to the presentation.